Hi, I'm Crystal, and today's workout is going to be Core 101, which is going to be the first part of a series of exercises specifically designed for the client or the person who cannot go to a gym, does not like going to a gym, or just feels intimidated going to a gym. Now, it doesn't require very much space. You don't have to have a lot of equipment. All you need is a ball and one pair of free weights, which I'll show you later on in the program. What we're going to do today is, like I said, core exercises that are designed principally for people that have lower back problems, which is probably 80% of the population that comes to me. I also have sciatica and stenosis of the spine, which was caused from an accident 16 years ago when a minivan rolled over my hip. I've never had surgery. I had a walking cane for 8 months 16 years ago, and I finally decided to research and to design a program that was going to work for me, and it was going to help the foundation of my body, which is really what core muscles are all about. Assuming that you've just done a 10 to 12 minute warm-up of cardio, now that could entail having a bench in your house, doing a little quick bench warm-up, or if you have dogs like I do, going out and walking briskly with the dogs, or if you have a treadmill or elliptical or whatever in your house. I assume that you've done that, so now your capillaries, your veins are open, and the blood and oxygen are being distributed throughout the large muscles of your body. So with that in mind, we're going to do the first exercise. This is called prone iso abs or plank. So this is very common in yoga class. We're going to time each interval for 30 seconds. Remember, this is basic core. As you continue to progress, you'll move it up by 15 seconds. So I have this set, and I'm just going to be on my elbows. If you notice my back, and Brian, you can help me here, he's shooting me. I just want to make sure that I'm not getting into posterior or that anterior pelvic tilt I told you about. My back should be completely straight. I'm also pulling my navel point in as much as possible. So therefore, I should look like an ironing board, and this is called a plank. So there's no movement whatsoever. You're going to hold this. I've got 3 more seconds to go. Now I'm done. And now I'm going to take a break, and I'm going to do child's pose. This is just a nice stretch to do right after you've done plank, so that you can just stretch out those lower back muscles in case you feel any tightness or friction. So I'm going to hold this for 15 seconds, and I'm going to repeat the same exercise again for 30. I'm assuming that's 15, so let's start again. So I've been doing these for a while. The very first day I did this, I could only hold it for 15 seconds. You'll feel a trembling sensation right at that point that I told you about, 2 inches above and below the navel point, and primarily the abdominals, not so much the lower back. So you'll know and you'll feel that you're getting stronger as you progress throughout these series of exercises. You also want to do these 3 times a week. 4 times is maximum, but no less than 3. So we're at 30 seconds again. We're just going to stretch out and just breathe. I think my dogs are getting jealous because they want to do core as well. So we're going to do the third set. The third set is going to be a variation. It's a little bit more advanced. So now you're going to lift one leg for 15 seconds. So those of you that are fitness gurus and enthusiasts, the first set might be too easy for you, in which you can do this. And we're just going to hold it for 5 more seconds, and then I'm going to switch to the other side. Notice I'm not lifting my hips, and notice that I'm staying in a straight line. So now we're switching to the other side. And after this, I'm going to put my dogs up. Thanks for bearing with me. And that's 30. Last and final stretch of child's pose or balasana. This is called a supine hip extension, and this is where you're going to want to bring in a ball for the rest of your workout. Now, I prefer a 65 centimeter ball. You can also use a 55 centimeter, and I'll tell you why later on. You're going to raise your back a little bit higher with the 65 centimeter ball, so that means you're going to work a little bit more, and that's the whole purpose. So what we're going to do here is just bring your hands out to a 180-degree angle. Keep your feet together. And then you're slowly going to lift your tush up off the floor. Once again, you're balancing the ball. This requires a little bit more equilibrium. You're squeezing your hamstrings, your glutes, and you just want to make sure that everything is tight on the back of your legs. This is not working core. This is basically just relaxing and barely lifting your back. This is what we want. We want full engagement. Once again, you're going to feel this primarily on your lower back, whereas the first exercise, you felt it on the front of your back or where your abdominals primarily are. So we have 4 more seconds to go. Notice that my calves are on the ball, my knees are not on the ball. That was 30. Slowly relax, take it down 1 vertebrae at a time, and then we're going to stretch out for 15 seconds. We're always going to do a reciprocal stretch, so any tight muscles that you might have during these isometric exercises, we're just going to lengthen and stretch out a little bit. So we're going to do it again. Second set, 30 seconds. Now what I'm going to do is I'm going to bring the ball a little bit further away from me. So now I'm on the Achilles tendon and I'm on my heel, and this is a little bit more advanced. You don't have to do this day 1. You can work up to it. So if you prefer to bring the ball in a little bit closer, by all means you can. Also, what I found is really interesting, if you have a pen or incense stick, well, you don't want to burn yourself, so you need somebody else to help you, but you can actually grab a pen and put it underneath your back and the floor. If your back is touching the top of the ballpoint pen, then your back is too low. That's exactly, and it's been 36 seconds. So let me bring this down. I love talking, by the way. So we're just going to stretch out for 15 seconds more, and then we'll do it again. This is also called a bridge on the ball, if I didn't mention that already. Supine hip extension is just the physiological name, which is too difficult to remember, so I just call this bridge. Let's go. 1 last set. And here we go again. So if you have a shirt, you want to tuck it in to your pants or your shorts or your skirt, whatever you're wearing. And if you have a mirror in a house, fantastic. You can see what your back is doing in the mirror. It needs to be full length. More advanced students might want to just bring their hands above their chest like Money Penny. So that's about as good as it gets in this position. Or you can bring your hands by your hips, which is intermediate. And then, of course, beginner is right out to the side. And that was our very last second. And we're just going to stretch out. And then we're going to go into my favorite exercise out of the first 3, which is what we're going to do next. And here we are. This is exercise number 3, which is called forward ball roll, or as most of my clients call it, praying to Mamma Mia, me being Mamma Mia. Let me show you the exercise first, and then we're going to break it down. So we're going to start with our back in a vertical position, stacking the spine. Very important that your feet are relaxed. They're not up on your toes. Now, I know a lot of men have problems stretching. They complain that their thighs hurt and that their ankles hurt. So what you can do is grab a soft, maybe a big pillow, an orthopedic pillow, double it, put it underneath your tush so that your knees and your quads aren't feeling the brunt or the tightness of this exercise. I also suggest a soft medicine ball, and I don't have one. I have a hard medicine ball that's not here. A soft medicine ball is great. You just put it between both of your calves and you can come back and sit on it. So let's go ahead and go as if none of us have any kind of tightness, restraints in the lower leg position. So I'm rolling the ball out, and my chest is going to hit the ball at the very end of the exercise, and then I'm pulling the ball back towards me. My horizon is directly over my thumbs, and then I'm pulling the ball all the way back. What I do not want you to do is this. Some people go up, and then they kind of crash down. That's going to put too much pressure on your shoulder joint. The position of the ball is extremely important. For example, if the ball is too far away from you, watch what happens when I'm here. This is good for advanced people, but my chest is not hitting the ball. So if you have shoulder impingement problems, if you have bursitis, tennis elbow, torn rotator cuffs, then this will not help you at all. It will actually hurt you to keep the ball so far away from yourself that you have no support underneath your underarm. So the position of the hands is extremely important because you can also cheat. Watch what happens now. My chest hits the ball and I'm not doing any work for my core. So what I say is, if you have a mirror, again, really important to find the placement, or if you have a reflective glass behind you, you can kind of see yourself in the mirror, and you're just going to roll wrist, elbow, forearm to tricep, tricep, elbow, forearm to wrist, and that's usually what I tell myself when I first started. Each set's comprised of 12 to 15 reps. You're going to hold for 1 second, and then you're slowly going to pull back. So what I'm doing basically is squeezing with my glutes and with my core muscles on the front and the back of the spine. You're going to feel this. This is a little bit more intense than the first 2 exercises, but you're going to feel like you're definitely working. And I'm also going to identify several different muscle groups that you're working at the same time. First of which are lats. So this is the largest muscle group, and you'll see as if I'm rolling the ball. Second are going to be your deltoids. You're working anterior, posterior. Third, tricep. Fourth, lower back. Fifth, core and abs. And sixth is primarily a little bit of your tush or lumbar. So once again, this is about the pace that you're going to do the exercise. You're never going to leave the ground. Your knees stay firmly planted. So that pretty much is the forward ball roll exercise. All right, now we're going to get into our first standing exercise out of our Core 101 series. This is basically called a knee tuck with a push-up. So let me show you first of all how to mount on the ball. You're going to start out at the edge of your mat, and I want you to just waddle out on the ball, starting on your thighs, your pelvis, and then with your hands, you have to move gently across the mat. Now it looks like we're in a plank, but now the plank is occurring on our hands instead of on our elbows. Notice that my back should be straight. I'm not allowing it to fall, and so that means this is not tightening your core muscles, and this is. From this position, we're going to get started. All right, one important aspect of this exercise is the surface that you're using and maintaining the 90-degree angle. So as you've noticed, I've changed 2 things. I have now put 2 of these nice soft mats underneath my wrists, and in turn I'm using a 55-centimeter ball instead of a 65. You can choose which you want. My arms aren't really long, that's why I'm choosing a 55. So I'm going to pull the ball in. Notice I don't have to come up on my fingertips, and now the ball goes behind me. When you use a smaller ball, you're going to invoke more core muscles, which means it's a little bit more challenging to balance. Let's watch the way I do a push-up from this perspective. My arms are now, they should be exactly at a 90-degree angle, a little bit further. So between my wrist and my elbow, forearm, shoulder, chest, that's 90. This, however, is not correct. So you can see my wrists are breaking, and that really, really causes some pain in the wrist joint after you finish. So just make sure if you have a soft surface area, that's where you want to do your push-ups. And that's about all I need to show you for that exercise. Now, remember to do 12 to 15 repetitions for each set. You're going to do 3. Between each set, you get to relax, and you can stand up. You don't have to stay in this position. So I'm just going to keep going, and then we're going to stand up. All right, now the very first part of this, when you're in this plank position, is the position of your quads and your knees on the ball. So the ball should not be so far away from you that you can't move it and control it. What you're going to do is walk gently so that the lower quadriceps and the knees are on the ball, ankles and shins off. From this position, imagine yourself pulling yourself up like a cannonball. You're stretching out your lower back. You're merely rolling the ball back behind you. You'll notice this ball might be a little bit too big for my body, and I'm going to show you what I mean. When I pull the ball up towards my chest, I might come up with my fingertips. I feel like I can control the exercise a little bit better, and you're welcome to do that. That gives me a final full stretch like a tight little ball, which is stretching my lumbar. Now I'm going to add a push-up. So I do my push-up here, my elbows come to the side, and my hands are in a 90-degree angle from my wrist to my elbows and to my shoulders. If your hands are too close to you, you are going to, perhaps in the long run, cause pain and injure and exacerbate carpal tunnel syndrome. So make sure that your hands are spread out to a 90-degree angle. You do not have to touch your chin to the mat. You can go halfway down, halfway up. Or if this is too much for you to do the first day, then just do 12 to 15 knee tucks. And notice what's happening. The ball's getting a little bit further away from me each and every rep. So you might have to pull the ball in again, manipulate it according to your happy body, and make sure that it feels comfortable to you. Sometimes I advocate doing an alternating set of a push-up and then one knee tuck. And this is working chest, shoulders, tricep, core, lower back. Phenomenal exercise. All right, now you have to find a wall, and I'm lucky because I have a little bitty step that I can wedge my feet against. So you're going to position yourself on the ball somewhat like the last exercise, except we're not going to be moving your lower body towards your upper body. We're only going to be hinging down throughout the hip area. So notice when I come down on the ball, my chest is not hitting the ball. This is very important. If the ball is here, you're not really doing anything for your lower back. You get to cheat. And these exercises are specifically for the lumbar. So what I'm going to do is just move the ball back underneath my pelvis. My knees are slightly flexed, and I'm just going to lower and lift my upper body. I'm going to hold my body for 1/fraction of a second, kind of like I feel like the Rocketeer. If I was being shot out of a rocket, I would imagine that I would be on this diagonal as I'm being shot out. I don't know. That's just the visual that came to me right now. So position 1, I call these penguin hands. These are my wings, and I'm just leaving them right by my hips to help me push a little bit. I would recommend you stay in this position. If you have a strong lower back, well then by all means, these are airplane arms, and this is going to put a little bit more pressure on the lumbar. So this also takes a little bit more balance and coordination, so you can choose whatever you want. And you're not going to want to do more than 12 to 15 reps per set, because your lower back will feel like it's about to get a cramp in it when it's time to stop. And also you don't want to pull up this far. That's compression of the spine. Now, my orthopedic surgeons have all agreed that this is one of the best exercises you can do to strengthen your lower back without complicating an issue that's already there, which is my case. So I'm assuming this is about 15. I'm going to stop right here. I'm going to show you another option for your legs. Some people prefer to bend at a 90-degree angle. You definitely can do that. You're actually going to hone in more on the hamstrings. So we stopped doing the airplane arms with our legs outstretched, right? So now I'm going to show you, you can keep your knees bent. You're going to bring your arms and conjoin them and glue them. Fasten them by your ears. And now this is about as advanced as it gets. You're lowering your upper body, and then you're slowly lifting and holding for 1 second without jerking. And you can choose, do you want to do maybe 5 reps this way? Perhaps you want to do 5 reps like an airplane, and perhaps you want to go back so that you can splice a different combination. As your back gets stronger, you'll be able to hold this the entire time. Now I'm just going to straighten my knees a little bit and show you that it's really the same exercise. It's just whatever makes you feel comfortable and safe, and more safe basically against a wall. All right, so now my lower back is really tight and I can feel I've done some work. Remember what I said, the first 2 core exercises we have to stretch out. So I'm going to just lengthen my spine, stretch my knees, reach out for my toes. This is static stretching. There's no movement at all. Or you can do dynamic stretching, which means there's movement added to the stretch. I'm sitting up straight, like I'm just sitting behind my computer, and then I'm merely reaching out, flexing my toes. Relax your neck, and you can do this back and forth until you're ready to go into your next set of back extensions. I'm inhaling up, and then I exhale as I lengthen through the hamstrings and lower back area, trying to reach and touch my toes. And then we're going to reverse it, flip it and reverse it. So now we're going to go into our last and final set of the hour. These are called ball squats against the wall. So basically, you're going to slide across the surface area of the ball. Your shoulders are going to be pinned against the ball so that you can feel your neck and head also touching the ball. So this is wonderful for your rhomboids and to open up your chest and shoulders. Now, what you're seeing with my legs is that my legs, when I sit down, they should be at a 90-degree angle, just like I showed you with my arms. If you start out with your feet too close to the wall, look how my knees are now buckling over my toes, which in the long run will hurt and can cause damage to the cartilage of your knee joints. So walk your feet out, and then you're going to feel that you can actually use a little bit more of your hamstring, your booty, in conjunction with the quads. You might want to know, well, how does she know where to put the ball behind her body and against the wall? When I'm sitting down in a 90-degree angle, notice that my core, once again, is straight. My spine is vertical. It's at a 90-degree angle. This is cheating. I see a lot of people at the gym. Once again, we're getting into that bucket tilt that I talked about earlier. So you don't want to walk out with an anterior pelvic tilt. You've got to position the ball behind the rhomboids, behind the shoulder blade, so that when you sit, your lower back is not touching. Because then you're going to be walking, once again, with perfect posture, and that's what I want. So you'll do 12 to 15 of these. Your body is going to tell you how much it needs to do every set. And then the second set, we're going to incorporate our dumbbells. So now we have our very final exercise of this hour, which is going to be ball squats against the wall, like we formerly did, except now I'm going to add weights to do bicep curls, which is going to raise your heart rate a little bit, work the heart and lungs a little bit more than they have been previously. We're going to get in our same position, and you have the option. I'm using 8-pound weights. I like a nice, comfortable weight that I feel that I can pump for 15 reps, and you can choose to do this throughout all 3 sets, or you can just do a warm-up set like we just did and then pick these up for the second and third set. Right now I'm doing basic bicep curls. You can also do hammer curls. So what I advocate is if your hips are a little wide, usually hammer curls will keep your elbows kind of away from the hip area into these nice linear lines. Also remember, you only want to drop your booty to a 90-degree angle. You don't want to come all the way down below 90, nor do you want to squat to 45. So make sure that you're gripping and engaging with your hamstring and glutes. Mind you, the position of the ball is extremely important. So make sure that your lower back is not touching the ball, and make sure that your shoulder blades are pinned against the ball for every single repetition. I'm putting the weight in my heels so that my hamstrings and again my glutes are also picking up some of the weight, so I'm taking the pressure off my knees. And that's about it. Well, that concludes our core strengthening exercises and our core integration exercises for Core Training 101 today. I hope that you enjoyed what we did together, and I hope that you continue to do this throughout the week and throughout your life. Remember, I'm just going to sum up what we did. You want to do these 3 to 4 times a week, especially for chronic back pain clients. Maybe 3 will be all you can do at the very beginning. Start the first core strengthening exercises at 30 seconds. If you can't build up to that, add 5-second increments every time you do this. Eventually, you'll be able to do 1 minute of the plank without any problem, or the bridge. And then the ones that we did standing up, those are all going to be consecutive sets of 3 sets consisting of 12 to 15 reps without having to time anything. I'm telling you, this has changed my life, and this has made me active, and this has made me able to walk without a cane. And if I can do it 16 years later as I'm aging, you can do it at any age. See you next week.